Today on Cancer Buzz, small cell lung cancer identification and treatment. Welcome back to Cancer Buzz, the show for the cancer care professional. I'm your host, Summer Johnson. We know that a quick and accurate diagnosis is important for the treatment of small cell lung cancer and better outcomes. For care teams, that means members need to be aware of the signs of small cell lung cancer. Our guest today is here to detail the markers from his own experiences treating this disease. Dr. Adam Fox is a pulmonologist and an assistant professor at the Medical University of South Carolina in Charleston.
Because of the quick pace of disease of non-small cell lung cancer, that does make the disease a little time sensitive. Small cell lung cancer is really divided into a limited stage, kind of being confined within one radiation field or within one half of the chest, or extensive, spreading beyond that. And the survival and treatments between those two big categories can be quite different. So we worry that for a fast-growing tumor, we might have more spread of their cancer and thus have to change different treatment regimens and potentially have worse survival.
What are the patient signs you have found to be an immediate red flag for small cell lung cancer?
So the symptoms that patients can have are pretty nonspecific. The things that really jump out to me are the clinical presentation on imaging. And so some of those features include large mediastinal masses and lymphadenopathy. For people who are used to seeing lung cancer and chest imaging, the appearance of these lesions being on the larger side for lung cancer is kind of a switch in our heads that maybe the small cells is implicated. Additionally, the pace of disease is really important to us. So for any patients who have recent chest imaging that really is normal or doesn't show these large lesions, the sudden appearance on the order of months would be a red flag for us, because a typical non-small cell lung cancer grows much slower than a small cell lung cancer. In most patients, while small cell only accounts for 10 to 15% of all lung cancers, almost all patients with small cell lung cancer have a smoking history. So certainly it doesn't just having a smoking history lead us to think you might have small cell. But in combination with those other features, that would be a red flag as well.
What's the difference between small cell lung cancer and non-small cell lung cancer that we should be aware of?
So the differentiation between small cell and non-small cell is really the way they look under the microscope. That's how they're kind of differentiated to begin with. And then the other thing is really their treatment. Their treatment is a completely different treatment regimen. And so confirming the difference between one and the other is kind of the first step when we suspect a patient has a primary lung cancer.
Is there a perfect turnaround time from first seeing the patient to diagnosis?
So that's always a tricky question, because we do have to balance that time factor with making sure that we're selecting the best method of biopsy. So, the fundamentals for anyone with lung cancer is to pick that biopsy site that's going to provide the diagnosis, at least some stage information, and any tissue needed for extra stains to confirm the diagnosis, or mostly in the case for non-small cell lung cancer, biomarker testings for making treatment decisions. And so when some of those cardinal features, quickly growing, bulky, central adenopathy, those should all kind of pique our interest. And, ideally within 1 to 2 weeks, you've got your procedure performed in pathology, rendering an opinion.
What steps can providers take to ensure a timely diagnosis?
I think conveying the concern for small cell lung cancer to people who are either scheduling or performing the procedures can be really helpful. I know that whenever I have a strong suspicion clinically that a patient may have small cell lung cancer, I make sure to put that into my referrals and orders for either staging scans or for biopsies. And I also communicate that to our nurse navigator, who often helps get people from point A to point B. So even once staging and diagnosis is rendered, having that in the back of my navigator's mind that small cell was kind of the predominant leading diagnosis, that usually can help everyone set into motion even some of the treatment planning stages for small cell lung cancer.
Thank you to our guest. Check out the show notes for more resources on small cell lung cancer diagnosis and treatment. Today's episode was made possible by funding through AstraZeneca and G1 Therapeutics. Thanks for listening. For the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.